All right, so thank you for joining me today, Dr. Mezoff and Dr. Alter. As you both are very aware, we are in the home stretch of this pandemic, but to get us over the finish line, it's really going to be all about the vaccine. So while millions of Americans have been vaccinated, there's many more that are still pretty weary about getting it. And one of the reasons we're seeing vaccine hesitancy is because of the many myths and misconceptions about the vaccine. So we're hoping to use our time today to help clear some of those up. So if it works for you, let's start tackling some of the most common myths about the COVID-19 vaccine. So Dr. Alter, to kick us off, can you address the myth that's about the vaccine was developed too quickly?
Yeah, Katie, all the steps in approval, and remember, this is a emergency use authorization. The FDA is looking at full approval, but all the steps that were done in evaluation of this vaccine, looking at its safety, the antibody response, its effectiveness, we're following the same that we've always done. It was just kind of moved up a little bit faster. No steps were not looked at. No steps were skipped. And to me, it actually states that when you look at the studies in the past, we probably could have done it more efficiently like we did this. And also remember that we are still collecting data as time goes on. And so, I think it's trying to assure individuals that no step was not done and normally as we would do to look at any new medication or any new vaccine.
Okay.
Katie, I'd like just to add another part of this, and what Sherm says is 100% correct, is I think what sometimes folks forget is that there was such a global urgency to do this that funding was up front. So many times when you're developing new things, part of the challenge is getting funding in order to be able to do this. But countries put a lot of money up front, which helped to make the process move faster. So I would again say no steps were skipped, but it happened fast in part because there was an intentionality around this that said, let's all contribute money up front and not wait for results because we know we need to get this done.
And Katie, that's exactly right. Took on what Adam said. Not only was it funding, a number of researchers and countries and organizations came together at the same time, which is unique, I think. So you had all the funding, you had all the expertise come together to make a very urgent need for the vaccine.
And it was therefore efficient, not rushed.
Right.
Mm-hmm. Yeah, we had the entire world working towards a common problem. So with those reasons combined.
In all honesty, in medicine, that's just doesn't happen.
Mm-hmm. Mm-hmm. Well, another myth around the vaccine, Dr. Mezoff, is we don't know what the long-term side effects are of the vaccine. Do you mind addressing that one?
Sure. And again, Sherman will chime in at the end, but I think what most vaccine experts will tell you is usually within the first few months, you will have seen what it is you need to see from a long-term basis. Remember that the first trials of this were more than a year ago. So we already have enough time in to know pretty much what to expect. So the long-term, if you will, there really are precious little things that really affect you in a quote long-term way. I might point out, and again, we probably get to this, that adults that have had COVID, more than a third of them have long-term side effects from having been infected. We already know that 30% exists, and that's far more than any vaccine side effects. And in kids, it's fairly similar, which is that even with mild COVID, more than a third of kids may have months or 6 months or longer side effects from having had the infection.
Yeah, I don't have much to add other than one point. In many vaccine trials, the follow-up for adverse reaction side effects is usually around 6 months or so. It was specifically designed in all the adult studies, and I assume for the children's studies, that the follow-up is 2 years. So, I mean, granted, we're only, we're less than a year out, but I think there is, again, more emphasis at looking at both short-term and long-term adverse events, which none of us have seen and none of us expect.
Well, and one of these long-term side effects that people are concerned about that comes up a lot about the vaccine is around fertility. And so there's been some misconceptions that the vaccine will affect women of childbearing age and men too around the fertility. Do you mind addressing that one, Dr. Alter?
Yeah, I think it goes back early on. There were a handful of investigators that were interested in that. One of the main antigen, that what we make antibodies to, that causes antibody response when you're vaccinated, was very similar to an antigen, a surface protein in a placenta, for example. And it was turned out that there's no comparison at all. And if you look at all of the millions of individuals, women that have also received it, there has been no effect on fertility. From a scientific point of view, the RNA or even the vector vaccine, the Johnson & Johnson vaccine, doesn't integrate into the tissues. And there were even individual women that got pregnant while they got the vaccine. And as a matter of fact, it's now recommended because we know that pregnancy could be high risk to vaccinate. So I think there is absolutely no data to date that immunization with this vaccine will affect future fertility of men or women. And again, people will continue to follow it, but I think that is a very, it just doesn't happen.
Okay, great. I think that's going to help a lot of people feel reassured about their choice. Another misconception people have is that they're young, they're healthy, so why do they need to get vaccinated? Dr. Mezoff, could you address this misconception?
And again, I'd like to go back to what I was saying earlier, which is that the mortality is less clearly the younger you are, but the complications and the morbidity aren't always less. In fact, the studies I was looking at for long-term COVID, the average age is less than 50 for people who get that, not necessarily the older age group. And long-term can mean shortness of breath, like you need oxygen for 6 months or longer. It can be what they have referred to as brain fog. Who wants to have to worry every day at their job that they can't think clearly enough? They've done studies in the adolescents, and they've determined that it's 3 times more likely for an adolescent to end up in the hospital from COVID than it ever was with flu. And of those kids that end up in the hospital, about 1/3 of those adolescents end up in the intensive care unit. So young age certainly affects the quote mortality rates because they're much higher with older age, but it doesn't mean this infection can't cause significant problems for you.
Mm-hmm.
And I know, Sherm, other things?
No, I think it's a good answer. It's a good answer. Yeah.
So what about people who've already had COVID-19? Do they still need to get vaccinated? Dr. Alter?
No, I mean, people are collecting data on how long you remain immune after you acquire the disease, similar to how long you'll have immunity and protection from the vaccine. We do know that individuals, although uncommon, can get another infection by the coronavirus if they've had one. We also know that the immune response is boosted in persons that have had the disease when they get the vaccine. There is really no contraindication to not getting it. The benefit is that it will further protect an individual who's had COVID-19. So yes, we recommend that those persons get a vaccine.
Yeah, that's interesting. I didn't realize that I knew they had some baseline immunity, but then just to have that kind of re-upped by the vaccine, that's good to know. One of the other myths around the vaccine is that the side effects are dangerous. We talked about some of the long-term side effects, but maybe if Dr. Mezoff, you can address the short-term side effects after getting your shot.
You know, the short-term side effects are what I would call maybe more annoying for the most part, in all honesty, than they would be what I would consider serious. So if your arm is sore, if you're achy for a day, or if you're tired for a day or two, in general, and we have this in the scientific research, and we also have it up close and personal at the hospital, more than 80% of people who get a shot come to work the next day. We just know this to be true because of the thousands of folks we've immunized here. Mm-hmm. And of those 20% that didn't, they're at work by the following day. So with any vaccine, there can be achiness, sometimes even chills, sometimes tiredness, sore arms. Again, not minimizing the fact that sometimes that affects different people in different ways. But to me, again, if you look at the long-term benefit compared to those short-term effects, I don't think there's any question about the benefit of doing the vaccine.
Mm-hmm. Yeah, short-term is the key word. It's only about 24 to 48 hours, I think,
48.
for people, right?
Yeah, for the vast majority.
And another myth that we're seeing that I've also heard around the flu shot is I don't want to get the flu from the flu shot. I don't want to get COVID-19 from the COVID vaccine. Dr. Alter, could you address the myth about can you get COVID-19 from the vaccine?
You need to sort of address it in a few ways. Yes, I will. But I mean, there are some vaccines that we've used for years that are dead pieces of the infection, for example, or part of the organism, and some live viruses. Now, this vaccines, the mRNA vaccine, the Johnson & Johnson vaccine, are not alive. They are pieces of genetic material that are injected into a person, and that genetic material sort of gives messages to the cell to start making antigens, proteins, that the body will develop antibodies against. So you absolutely cannot get the disease from an inactive vaccine like this. And so that is a obvious myth and misinformation. There is absolutely no way you can get it. The vaccine is not alive.
I would just like to reiterate what Sherman said. You can't get infected from this vaccine.
Mhm.
You just can't,
Mhm.
because it's not physiologically possible.
Right.
Mhm.
Right.
And what about the myth or misconception about, I'll just wait to see how this plays out before I get vaccinated?
I would say that, I understand that, but what happens if you get sick while you're waiting? Or what happens if you make somebody else sick while you're waiting? So again, and obviously I feel strongly about the benefits. I think after roughly a year of seeing what to expect, seeing that in the states like now Ohio, where the higher the vaccination rate goes, the lower the incidence of this infection is. I appreciate the fact that this is a hard decision for folks, but I think there's been enough time to decide the benefits far outweigh the risks.
Mhm.
Yeah, I will tag on to what Adam just said. When some people similar will say, well, I'm just going to wait to see what happens. Well, what are you waiting for? I saw a number the other day that I believe we're approaching in the world, close to 1 billion people have been vaccinated. I mean, I'm not sure what we're waiting for.
Mhm.
It's not going to change. Totally agree with what Dr. Mezoff said.
Mhm. Yeah, after 15 or 16 months of this, I think we've waited long enough to have the vaccine available, so people should take advantage. And then the last question, and just staying on the topic of vaccines, but pivoting just a little bit, Dr. Alter, could you provide any insight into the current House bill, the HR 24811, the bill that is going through the
Yeah,
House, which would...
Yeah, it's House Bill 24811. I think
Okay.
that initially this was brought up by the committees at the House in an approach to COVID vaccine. And the idea there would be that, for example, certain entities, hospitals, schools, businesses, could not mandate an individual get a vaccine, for example, for employment or continued employment. It is, in addition, it also said that an entity cannot mandate a mask in any situation. And as much as I would disagree with a lot of that, it unfortunately has become expanded to all vaccines, including childhood vaccines, which all of us as parents and people that have been alive for a while realize that we don't see these diseases that we used to see because of vaccines. So this bill runs a risk of dismantling all those protections that we've done. It would allow individuals to refuse, which they can already in Ohio, vaccines, to not allow various entities, including schools, to require evidence of immunity from a vaccine. So what happens if you have an outbreak? And it's extended to multiple different vaccines. So I think that this is a giant step backwards, which makes absolutely no sense from a public health point of view. Why would we make it easier to not be vaccinated when we've progressed so rapidly and correctly over the years to prevent diseases? And I think, right now there's more House hearings. I think there's an important one tomorrow on one of the committees. So we'll see what happens. But I think this bill is somewhat of an overreach and is, in my opinion, a dangerous overreach.
Katie, I'd like to also
Sure.
voice an opinion. I think what Sherman said is spot on. First of all, as obviously somebody who has been in pediatrics for a long time, 40 years for anybody counting, I have seen these entities, these diseases that vaccinations have prevented through the years, devastate children. I have taken care of those children after their devastation. I think it is a very bad idea to undo all the good that's been done through the years to keep my children and my grandchildren safe. And that's what this bill will do.
Mhm.
We can debate all we want about the benefits of the COVID vaccine. To think that you're going to legislate me from being safety conscious to prevent people coming into our hospital from getting sick because we asked them to wear a mask, to me is again not something a legislature should be doing. I think they're not exercising their ability as a change agent in a positive way. I think when they start talking about personal freedoms, how about the personal freedom not to get sick by walking into a hospital, which we will eliminate if we don't allow the public health measures that Sherman talked to. So I appreciate the fact that there are folks who are very cautious about COVID and that vaccination. Let's have that talk about COVID, but to undo all the good that has been done for 20, 30 plus years to prevent your children from getting sick, I think it's a really bad idea.
I'll chime in very briefly. Ohio already has a very lenient rule on a family or a patient refusing a vaccination. In Ohio, you can, obviously medical reasons, which would be important. I would agree with a medical contraindication to vaccine, but you can also refuse it on a personal belief and on a religious ground, which is a lot easier than many other states. So I think we're already too lenient. This would make it even worse than that, I think.
Well, thank you for your really thoughtful feedback. This is helpful, I think, for people to understand exactly what the bill does and doesn't include. So thank you for answering that question. And just to wrap up, is there anything else you want to mention about the COVID-19 vaccine? Any myths, misconceptions that we haven't addressed that you want to be sure to talk to?
I don't think so. I think that people need to get past this misinformation and start getting vaccinated. I mean, the numbers in Ohio, our numbers locally, our numbers in our hospital show what we are doing. And so I see no reason not to vaccinate. And I think I could add that if one is not vaccinated, then you need to keep following everything we've been doing the last few months. For example, mask wearing. And so in order to protect yourself, your child, and the community, we have a lot of evidence that these are safe and effective vaccines. They just need to vax up, basically.
Mm-hmm. Dr. Mezoff?
I would agree with Sherman. I just say that I truly believe this is safe. I was one of our first recipients at the hospital because I wanted to show that I felt it was safe. As soon as my grandchildren are old enough, they will be vaccinated. And I think it is a way to make sure that you keep yourself and your family safe. And I think that's what all of us, especially parents and grandparents, want to do. So to all of you who've already been vaccinated, thank you. Thank you for stepping up and doing it. But for all of you who haven't, if you want conversations to help you feel better about things, if you need more information, that's why we're here. But let's separate fact from fiction and let's not make this a political discussion. This is about keeping kids and families safe. Please just look at it that way.
Great. Thank you so much for your time today. I think this has been enormously helpful. We'll share this with our community and with our staff. So thank you again, and we'll talk to you soon.
Katie, are you going to edit the end of this?